My name is Sherry Cobb, and I live in Royce City, Texas. And I am a 15-year cancer survivor of breast cancer. In May of 2009, I came to UT Southwestern and found Dr. Cheng, Dr. Jonathan Cheng. And to this day, he's my favorite doctor. I've had lymphedema since my original surgery back in 1996 when they found breast cancer in my left breast. And they found that breast cancer and they took my breast off. And then I went without any plastic surgery. I was just gonna go without anything and use a little prosthesis. However, they found breast cancer in my right breast 6 months later, and they wanted to do another biopsy. I just told them to take my breast off. So they did, and at that time they did Reconstruction the first time, not at UT Southwest. However, when my breasts started moving, my breast implants started moving, I was already a patient here at UT Southwestern. I have 13 other doctors here that are in different departments. So they recommended me to Dr. Cheng, and I came up here and I instantly made a connection with him, and we did the surgery, and then later we talked about my arm and my left arm and its lymphedema. My left arm was always about the size of my thigh, and very, very painful all the time. It took over my life, basically, as lymphedema does in whatever limb you have. So he explained to me that he had never done this before, that this was a groundbreaking surgery, and that he could fix it. And he was extremely confident that he could fix it. And I asked him how many patients that he had done it on, and he said none. I said, so I'm your guinea pig, and he said, no, you'll be my patient. So we proceeded to get ready for that surgery, and I guess it's been about a year and a half now. I believe it was in June of 2010 that I had it. Each incision was 4 hours. It was all done microscopically. And he's a genius surgeon. And to this day, as you can see, it's the same size as my other one, almost. Just about as close as you can get. I don't have any pain, nor do I have any remnants of feeling that I have lymphedema in my arm anymore. Dr. Cheng performed the surgery brilliantly, and my recovery was short, and it was pain-free, and it was didn't take very much time out of my life, and I am experiencing joy every day since I had that surgery. And I'd like to encourage anybody with lymphedema in their arms to come see Dr. Cheng here at UT Southwestern, because he can do it, and there is no doubt about it. And you can call me up and I will tell you that the same thing. Since my surgery and since our year anniversary of my surgery, I have been active in trying to communicate with the Lymphedema Association, with anyone that will listen. I've written the papers, the Dallas Morning News. I've written requests for interviews for in particular news magazines, and I can't seem to get anybody's attention. No one knows about this surgery, so nobody really believes that it's possible. And I would like to be a conduit to make people believe that it is possible to get rid of this disease. It is curable. It is curable with Dr. Cheng. I am excited. I mean, can you imagine having a disease that's incurable? Number one, I beat breast cancer. Number two, which was the fallout of the breast cancer was my lymphedema. And then I beat that. So what I can say is, if you want to beat these diseases, I mean, you know, your emotions and your drive and the right doctor can help you do that. You just have to be positive and stay as healthy as you can, which is what I do every day. And doctor, if you have this type of ailment and disease, I know Dr. Cheng can fix it. I mean, I know it. It's a fact.